Okay, what test was it that I had that reveals that I possibly had a silent heart attack?
You had a nuclear stress test.
I had a nuclear stress test. And the area of weakness is where?
Not an area of weakness. The area of the heart that's suggesting that you've had a heart attack is the inferior wall of your heart, which is the right side of your heart.
All right, so
you can have heart attacks, and your heart muscle becomes completely weak because of it, and you can also have small heart attacks which have not damaged your heart, if that makes sense.
so it appears that it, what? I mean, but you say there is a part that's dead?
Correct. That's
Okay,
not
at least that's
any
what
uptake of the nuclear medicine, which suggests that you've had a heart attack in the past.
Gotcha.
However, it's still not affecting the way that your heart is functioning as a whole.
So it, based on what you know now, it's not a real danger to me.
Correct.
Okay, that's good news, and that's what I want to make sure everybody, especially my wife, knows, because she's a little nervous right now.
I understand.
What's the next test you would like to do?
The cardiac catheterization.
A cardiac catheterization, and that will show us, that will confirm basically the scan that you did earlier.
Correct.
If we do this test, and if it shows that indeed I do have a damaged part of my heart, what do I do if I can't fix it? I mean, you can't cut it out or anything, right?
Exactly. If the vessel is completely gone,
right,
what we just have to do is just be aggressive in treating your risk factors. Right now, you're taking cholesterol medication. You have your total cholesterol under 200. But if in fact you are now a heart patient with coronary artery disease, your bad cholesterol, which is your LDL, is a certain criteria that has to be met. It has to be less than or equal to 70. For
Gotcha.
Patients who don't have coronary disease, 130, 150 is acceptable. Patients who are diabetic, the LDL has to be closer to 100. So there's different criteria standards to be made based on your risk factors for heart disease.
Gotcha. Now, what does the test involve? Do I have to go into the hospital for any length of time? Aetna.
Aetna. We can do outpatient.
It depends on my insurance?
It depends on your insurance towards where we can do it. We have a cath lab here in our office.
Gotcha.
And certain insurances allow us to do the procedure here. Other insurances, you have to go into the hospital to
Gotcha.
do it.
Okay.
So you would come in the morning, you would have the procedure done, going through the groin, shoot some pictures of your heart, and if they find nothing, great, no big deal. You leave the cath lab, you go home 4 hours later after they pull the lines.
Okay.
If they do find some blockages that need to be fixed, suggesting that you need to have a stent, then that would be done at a later date. You would have an admission to the hospital, 24-hour stay, and then you would go home.
And if they find something that's there that they can't address, then what they do is recommend addressing the risk factors.
Correct.
Well, it sounds to me that the sensible thing to do is to have this test.
Just to get some answers.
Well, I do have a question.
Sure.
The test we just did, it could be wrong.
Correct. Stress tests are not 100% accurate.
They're not 100%
but it's the
accurate.
most accurate non-invasive test that we have to look for coronary disease with patients with risk factors.
Gotcha. Okay, so there's a slight chance or small chance that you'll go in with the new test and find nothing.
Correct.
I'm betting you bet we will find something.
I mean, you may have the beginnings of some mild plaque in your vessels with your history.
Yeah.
But
That
the fact
could be
that you've had no symptoms whatsoever, we may not. You may not have had a heart attack.
Right.
But we don't know until we go in.
Until we go in and look. Okay. That makes sense to me.
And stress is a big risk factor too.
Is it? So I need to join a monastery and become a vegetarian. And
I wouldn't go that far, but
you wouldn't? It would work, wouldn't it?
I don't know if you enjoy to be by yourself and live like that, not me.
No, I'd be living with a bunch of meditating monks.
Exactly.
I'm not sure I would enjoy that at all.
I think I would go crazy, but that's all right.
Yeah. And I'd have to give up my little glass of wine. Do I have to give up my glass of wine?
You can have your daily
In
glass
fact,
of red wine. It's actually good for your heart.
Actually, it's good for my heart, isn't it? I've heard that. And it was the best news to come out of the medical field in the last 20 years, as near as I can tell. That and dark chocolate.
Yes.
Hallelujah.